Hello, everybody. Hello, everybody. Let's do bridge. Hello, whoever just joined me. Welcome. Got some things I would like to chit chat about, but see if anybody shows up. If nobody shows up, it is what it is. Hello, whoever just joined. It tells me when someone's in here, but it doesn't tell me who it is. Something I like about StreamYard or basically YouTube. I may, depending on who else shows up and how late I really want to do this, how long I really want to do this for, I may show the crystals again, because someone asked me to do a better video of it on a table instead of on the floor. Hey Martha, welcome. Welcome to the live. This is actually a really good live for you to come to, because I will maybe, depending on who shows up, I may be talking about my new collab that is going on November 1st. And if you have anything with horses, I don't know if we're going to do coloring, but it's definitely going to be diamond painting. That's what me and the other person do. Well, she also does resin work, but mostly we do diamond painting. So anything diamond painting with a horse on it does let you be part of this collab event, however you want to look at it. Some people call it a collab, some people call it a diamond painting community event. I'm also going to talk about a little bit about what I'm planning on doing next year in June, but things are still getting pieced together. But the possibility of me doing an event, I don't know if I'm gonna have any like partners or anybody help me with the event. It may just be me doing it by myself. But this event will be kind of hard for me to do because it's very close to my heart and it's very close to home. The event in June is all about the disease. It's the awareness month for the disease that actually killed my father. Well, I shouldn't say killed, but the disease that made my dad really, really sick and what he passed away from. Because I guess when you say killed, it doesn't sound very pleasant. But my dad suffered for 6 years with this disease. I don't know how to exactly say the first word. I'm trying to get my mom, who's a nurse, to help me abbreviate the first word of the disease. but the abbreviation is MG. Let me see if I can put it in the chat. Let's see if I can put it in the chat. I don't know if I can or not. This is what his disease is called, if anyone's still in here. It's called, like I said, I don't know how to say the word, Myasthenia gravis. I'm not sure how you say the first word, but its abbreviation is MG. And their awareness ribbon, you know how like you have cancer ribbons and stuff? But my phone is in the picture. There we go. That might be better. But it is, Martha, it is very similar to MS. It is a muscle disease, from what I understand and what I've seen my dad go through. It basically makes it to where a few of your muscles are unable to function properly. My dad, when this disease hit him, the first thing it affected was his eye. I remember him coming to my niece's and his granddaughter's birthday party, and my dad was kind of long hair, scruffy. He had gray hair, silver hair is what I called it, not gray, silver hair. And he had like, a mustache. He had kind of like the barbell kind of mustache going on with, goatee and beard, kind of like he looked kind of like a biker to me. He reminded me of a biker. The long hair, like not really long, like maybe to his shoulders length. And this is basically one of the last times I saw my dad. And he looked kind of like a pirate. He had on, I believe he had on like a white shirt with a leather vest. My dad always wore like leather stuff and like bracelets with, made of leather. He always had like that biker look. Well, when he came to my niece's birthday party, his granddaughter's birthday party, it was, I don't remember how old she was, but I remember we had Mickey and Minnie there. And he had on a eye patch. So, me being who I am with disabilities and learning disabilities and not knowing how to hold my tongue, I said, "Hey, Dad, what's going on with your eye?" And I'm also very much into the medical incline. Like, I understand medical stuff. I was raised with a mother who's a nurse. I was always around the medical field kind of stuff. And I've always been intrigued and interested in it. He said, "Well, I went to the eye doc. My eye stopped blinking." I was like, "Oh, that's interesting." And he said he's been to the eye doctor. They did all these tests to see why his eye is not blinking. It just, he woke up that one morning and his eye would not blink, kind of like a normal bodily function. Well, he went to the eye doctor. The eye doctor said they didn't know what was going on. And basically gave him the runaround, told him he had to wear this eye patch to protect his eye because it was not blinking, so it was not keeping moist like it should. He had to keep putting eye drops in his eye to keep it, moist and wet like it's supposed to be, so it doesn't dry out. Well, that started to go back to being functioning. And then he turned around and you have you have a muscle in your throat you have like this flap in your throat that opens and shuts when you eat and when you swallow. So when you're talking and breathing and not doing anything, you're breathing like normal, not eating anything. The part that makes you swallow is blocked. So then when you go and eat, when you go to swallow, this flap opens up so you can swallow, but it closes your airway so you don't like choke on your food. So it doesn't go down your air tube, your airway. Well, this muscle quit working on my dad. He ended up in ICU, basically had a vent, had a breathing tube, had a feeding tube, all this stuff happened to him. And that's when he was diagnosed with MG. Now, other muscles function poorly or stop functioning correctly. I'm not sure what other muscles he had that stopped working the way they should have, but this is the main muscle I have learned about and knew about with my dad. This disease there is no cure for it at this time. The treatment is he used to go, I think, like 2 times a week when he started this treatment. He goes to a plasma center at the Cleveland Clinic. My dad used to live not very far from Cleveland, Ohio. So he would go to the Cleveland Clinic and he would sit there 3-4 hours and they would pump out his plasma, clean this bad bacteria or bad, I don't know what it was that they were taking out of the plasma, but they would take it out and then they would put the plasma back in my father with all the good stuff still in it. And for a while there, he was getting really well. He was doing really good enough to where he was able to go once a week. And then he was able to go about once a month. And he was just functioning with this disease. Well, then all of a sudden, he was unable to eat. He didn't eat for like 3 or 4 days. He was losing weight. He was unable to eat or unable to breathe. So it was either one or the other. He wasn't able to do both because this muscle decided to quit working again. He ended up back in the hospital, in the ICU, breathing tube, feeding tube, trach. He already had a trach. He had a trach in his throat, so that's the way he was able to breathe. Things just went from good to really bad, like real fast, and that's what this disease did. When it wanted to show itself, it showed itself with vengeance. It was very awful for my father. It was very awful for my stepmom. My stepmom told my sister my dad would have these awful, nasty, very painful infections around his feeding tube, around where his trach was. It would be all red and inflamed and all this stuff. And It was just an awful life to live. And my dad lived with it for 6 years. And I want to bring awareness to this disease. It's an awful disease to watch someone live with. Yes, you can get it under control. Yes, you can do treatment, but there is no cure. Just like with the disease I have small fiber neuropathy. There is no cure. The symptoms can go away. My symptoms went away for a few months. Well, they're back. And no, I'm not talking about me right now. I'm talking about my dad's this disease that basically, I guess the only way to say it is it killed my father. I mean, he lived with it for 6 years. He was in and out of the hospital with one issue after another. He ended up going to Pittsburgh, PA, to the VA hospital over there. I don't know if he was life flown or if he went by ambulance. I'm not sure which way he went to get there, but his experience there, he basically told my stepmom, I will never do a vent again. So on the way home, on the way back to his house from Erie, Pittsburgh, he signed a DNR. I mean, I think she cried about it and said, please don't do this to you, to me and your family. And he said, well, I'm tired. I'm in pain. I'm suffering. If my heart stops, I want them to let me go. No choice in the matter. He was in his right mind. He was able to make his own decisions. There was no no reason medically that he could not make that choice. So he said, I'm not doing it anymore. I'm done. And I really, truthfully, deep down, I miss my father like crazy. But I don't blame him. I would have been done too. I would have been done 4 years ago. I would have been like, this is something that is not going to go away. There is no cure for this. And being in and out of the hospital 3-4 months at a time, in and out of consciousness, not knowing what's going on and what's going to happen next, it can't be fun. So yeah, I don't blame him. Well, when he was at Cleveland Clinic, or I think he was in Cleveland Clinic. Yeah, I think he was in Cleveland Clinic, and he was about to go through a surgery. They didn't know if he would make it through the surgery. They didn't know if he would make it through the recovery of surgery. But his valves decided to stop working properly. My dad was unable to go to the bathroom. And everybody knows how painful it is to be constipated. So my father was unable to go to the restroom. There was a bowel obstruction going on. Well, he was at the hospital and they said, we're going to do surgery in the morning. I went to work and I told my boss, I let her know, hey, my dad's in the hospital. He's doing okay, but he's going to have surgery this morning and I need to have my phone on me in case anything happens, because we did not know what was going to happen. I mean, my dad, the nurse could have went in there that morning and found my dad passed away. We don't know because my dad was so sick, we didn't know what was going to happen. We didn't know what to expect. So they go in and they did more testing, blood work, CT, MRI, all these testings, and they found the obstruction in my dad's bowel basically reversed itself. And they said, well, we've seen this before. It's not a big deal. Now we don't have to do surgery. Okay, cool. Well, this is the sad part. So if you're easily to cry, I wouldn't listen to this part. I would mute your volume or turn down your volume and give me like 2-3 minutes and you can turn back up your volume again. But my dad got a mucus plug. They tried to suck that mucus plug out. In the midst of trying to suction out the mucus plug, my dad's heart stopped beating. And like I said, I was at work. I was in the middle of doing a job that I couldn't really answer my phone. My hands were wet because I was washing dog beds and water and soap and all that. I glanced down at my phone. My mom called me. I didn't answer the phone because, like I said, my hands were kind of wet, and I didn't have a way to tell my boss, "Hey, my mom's calling me. Can I take this phone call?" I had to let them know when I needed to use the phone. Well, my fiance did a Google search for my work, and he called the front room, the front office, whatever. And I was in the small dog play area, playing with the small dogs, doing my job, keeping an eye on them and all that stuff. And the girl from the front came in and said, "Hey, Jen needs to call her mom ASAP." I looked at my boss. She was in small group with me. And I'm sorry if people are leaving. I'm sorry if this is something you guys can't bear listening to. So, um, yeah, I was like, okay, can I go make this phone call? And my boss is like, yeah, and if you need to go home, we totally understand. This is your father. So I go to the front room where I can hear my mom, or I think I went to the front room and then I went to the break room. I should have went straight to the break room instead of the front area. And I said, "Hey mom, I'm calling you back. What's up?" And she goes, "I am so sorry to tell you this." And I said, "What?" She goes, "Your dad's gone. Your dad has passed away." And I said, "Are you serious? Wasn't he wasn't having surgery?" And she goes, "No, he didn't have surgery. He had a mucus plug. They couldn't get the mucus plug out, and his heart stopped. And your dad signed a DNR." So my dad was gone. Then I hung up the phone with her, and she's like, "I will come and get you if I have to. You just tell me where to come to get you. I don't want you to get in a wreck on the way home because you're too out of it. I want you to drive. If you can't drive, I want you to pull off, and I will come pick you up wherever you are. We will come and get you in your car, and we'll get you home safely." And I said, "No, I'll be fine. I'll hold back the tears until I get home." So I went and told my boss. I said, "I'm sorry, my dad just passed away." She said, "It's okay. You can have the rest of the day, and I'll give you a couple days off." Because I had to go to where my dad lived to do a wake and a showing. My dad did not have a funeral. He was cremated. He was cremated that day. They didn't they didn't waste no time getting him cremated because I mean you can't leave someone without doing something. You need to preserve the body or you need to cremate the body because you rot really fast when you pass away. But so then I called my fiance and I said my dad passed away. He's like, I know. I didn't want to tell you, but I knew. And I'm like, why didn't you want to tell me? He goes, that's your mom. That was your mom's place to tell you that your dad passed. So my question to you guys, well, not really a question. I guess I can't say question, but so yes, in June, I'm having two. I'm having a diamond painting pen creator hopefully custom make me a diamond painting pen. I am having someone who does custom diamond paintings, possibly, fingers crossed, make me a custom diamond painting. If this person's unable to make me a custom painting, I am going to try to find a custom painting place or person, somebody to make me a custom painting. And the painting is going to, I already have a picture of what I want. It says, his fight is my fight. And beside it has a teal ribbon with butterflies by it. And underneath it, it says the disease that my dad died of. And that will be in the month of June. I will be doing it from June 1st till July 1st of 2022. So back to the happy stuff. Let me see if she's gonna come on. I don't know if my collab person I'm doing the collab with is gonna come in or not. If not, I can still let you guys know what's going on. And for that event, you can do any painting that has the teal color in it. It doesn't have to go with my theme. It just has to have the color of teal in it. Or we could do butterflies. But yes, I am doing an event to bring awareness to this disease because it is definitely not a fun disease to watch somebody pass away from. I think MG is very close to cancer. I mean, nothing will be be cancer, obviously. Cancer is very hard to deal with too. I've had 3 or 4 people that I know of that I watched die of cancer. I also know a few people that had cancer and survived it. This disease that my dad passed away from, like I said, there is no cure. There's treatment, there's ways to live with it, but there is no cure. And but this other collab I'm doing next month, it's called Horsing Around TSA 2021. It could be with anything with horses. You have to be subscribed. Actually, I'm gonna start a new live. That way I don't get both of these in the same live. So I will start a new live here in a minute. So if you want to come back, you can come back to the next live. So I don't have them both in the same live, like I said. So this one will be mostly about my collab, my event in June. So I will be back in a few minutes. I'm gonna get the done painting out so I can show it to you guys. But I'll see you guys in a few minutes. Come back to the next live. Alright guys. I will be back in a minute.